Hello, Dr. Vikki Petersen here. I want to speak with you today about the neurologic effects of gluten intolerance. Whether it's celiac disease or gluten sensitivity, we see a very strong association between how gluten can affect the nervous system. We've also learned that for many with neurological problems, they have very few digestive problems. We have talked about ataxia, where you have unstable gait, your balance is not what it should be. In those patients, a research study last year showed that only 10% of them had any digestive problems. So of course, the problem with that is that celiac disease and gluten sensitivity is thought to be a disease of the digestive tract. So if someone comes in and has absolutely no digestive complaints, there are not a lot of clinicians in this country that are even going to think that gluten could have any effect on a patient's neurological complaints. Ataxia we just mentioned, depression, anxiety, seizures, migraines. The list goes on, and these patients are suffering needlessly because their clinicians are unaware of this association. So I wanted to talk about that today for a couple of reasons. One, if you're talking about celiac disease, the standard testing is there's a blood test, it's called TTG, and that standard test is very much looking at damage that occurs to the gut, which in a classic celiac sense is something you want to look for. That's often followed up with an intestinal biopsy, where they take little pieces from the small intestine to show, once again, the classic damage that is done to the lining of the intestine. And that's all very well and good if you're a classic celiac and you've also sustained a lot of damage, because these tests are not sensitive tests, meaning a lot of damage has to occur before they'll show a problem. So they're not a good early warning at all. But what's really wrong about them, even beyond that, is that if someone is having neurological related problems, those tests are going to show negative. They're absolutely not going to show that there's any problem with gluten. But these are the people that get off gluten and have miracles. And as I said, I hear from these individuals almost every day from all around the world. And it's wonderful to hear from them, but then I'm always thinking, how about all those people that don't know and continue to suffer needlessly? So the good news, I mentioned that earlier test for celiac that looked for the damage to the intestine as a TTG test. It would be more accurately called a TTG2 test. And so little number 2 after it is the actual test. Now, research has shown that TTG6 is a much better, well, a fairly accurate marker in the blood, once again, for patients reacting to gluten that have neurological complaints, particularly ataxia, as we mentioned, that unstable gait. So that particular test is not available at the moment, but Cyrex Laboratories, who we've talked about before, we kind of talked about it earlier this year, 2011, because they came out with some much more sensitive tests than we've ever had before, which is always good news because we're pretty much plagued by insensitive tests. Not that they're perfect, but they're definitely better than what we've had. So they're coming out with this TTG6 test, which is great to know. But the thing that I wanted to go back to, and something we can do right now, since that test is not available and no test is perfect, is to put a plug in for what I consider a gold standard for gluten intolerance, and that is the elimination diet. And what you do is you eliminate gluten for 30 days, and at the end of the 30 days, you see how you feel. I'm amazed, and we say 30 days because the complete turnover of the intestine, of the cells, takes about that long, so that's kind of a minimum that we put out there. But I'm amazed at the number of people who get off gluten and 3 days later their depression lifts, or 2 days later they have all this energy, or their migraines go away, or their seizures start lessening in number or intensity. These neurological complaints, I'm not saying absolutely and always, but I'm amazed at how often the change happens really, really quickly in individuals. So I just wanted to discuss the strong association, number one, the fact that our standard tests are not going to show positive, and then the person is going to be told erroneously there's no problem, gluten is not the causative factor for you, which in many cases it is. The good news that a new test is coming out that will help. But lastly, the fact that the elimination diet of eliminating gluten, and I would recommend dairy as well, because the casein, the protein in dairy and the protein gluten in wheat, rye, and barley, they can play off each other, and there's a lot of problems that really show that both are needed to be gotten out of the diet, very strongly in autism as an example, another neurological problem where children do much better with a gluten-free and casein-free diet. So that's something that I just really want you to add to your knowledge base, that's something you can always do. And that's a free test. And I know people will say, but you've got to do that celiac test first. You've got to know if you have celiac. That would be great if you really knew you had celiac after doing those tests. What you'll know is if you have devastating classic celiac, I will grant you that will be the case. But if you don't have a lot of damage in the classical sense of it affecting only your GI tract or mostly your GI tract having a lot of damage, then you're going to have a false diagnosis. So that's food for thought, and please spread the word, let people know, especially people you know who have neurological problems, including schizophrenia. 20% of all schizophrenics are known to be gluten intolerant, and when it comes to autism, Dr. Fasano recently said that 20% of autistic children are gluten sensitive. So there's something to know, and I hope you found this helpful. Do spread the word, share it with friends and family, and until next time, I wish you very good health.